My name is Cebrina Swanson, and I am presenting my research over the compliance rates of type 2 diabetic eye examinations at a local clinic. Acknowledgements for this quality improvement project go to my faculty mentors, Dr. Mark Foster and Ms. Tanya Mead. Here is an overview of the poster board. Today, I will be discussing the introduction and research purpose, objectives of the study, research methodology, population, study findings, and its clinical significance to current and future practice. Diabetes affects over 100 million people in the United States. The number one cause of vision damage and loss in people ages 20 to 74 is due to diabetic retinopathy. Early detection through diabetic retinopathy screening could decrease severe vision loss by 90%. Previous studies have shown an estimated 100 to 120 million people have diabetic retinopathy, with at least 50% of those people undiagnosed. The ADA guidelines state patients with type 2 diabetes should have a diabetic retinopathy screening annually or biannually, depending on the degree of diabetic retinopathy present. Despite the overwhelming research describing the benefit of early detection and screening of diabetic retinopathy, multiple studies have shown the lack of adherence to the ADA guidelines. A national study conducted between 2010 and 2014 concluded that of the 298,383 type 2 diabetic participants, only 15.3% of those received the ADA recommended annual or biennial eye examinations. The purpose of this study is to compare diabetic eye examination rates of type 2 diabetics ages 45 to 64 at a rural family practice clinic to the 15.3% rate found in the national study. The primary objective is to determine what percentage of patients ages 45 to 64 with type 2 diabetes seen at a family practice clinic in Paragould have received the ADA recommended diabetic eye exam compared to the 15.3% rate of type 2 diabetics who received their annual or biannual eye examinations in the national study. The results of this study may provide valuable insight regarding the various factors that contribute to decreased diabetic retinopathy screenings in type 2 diabetics ages 45 to 64. A retrospective chart review was conducted for this quality improvement project. A descriptive design and randomized convenience sampling were utilized for this study at a rural clinic in Paragould, Arkansas. 50 charts were reviewed of patient office visits between January 1st to November 15th of 2019. Microsoft Excel statistical software was used to analyze the data to determine the statistical significance. Chart criteria during the review included patients, male and female, ages 45 to 64, who visited the clinic between January 1st through November 15, 2019, with an ICD-10 code of E11.9. Diabetic eye exam documentation between January 1st, 2017 through November 15, 2019 was included in the data collection to keep within the ADA recommended guidelines of annual or biennial eye exams. Exclusion criteria included age less than 45 or greater than 64, absent ICD-10 code of E11.9, and diabetic eye exams obtained before January 1st, 2017 or after November 15th of 2019. The findings from this study concluded that 22% of type 2 diabetic patients ages 45 to 64 received their ADA recommended eye exam at a rural family practice clinic in Paragould, Arkansas. That equated to 11 patients out of the 50 receiving their annual or biennial eye exam. When comparing the research findings to that of the national study, the rural Arkansas clinic did slightly better with diabetic eye examination compliance. Results were further separated by type of insurance. It is interesting to see how all the self-pay patients received their diabetic eye examination. However, over half of the patients had Blue Cross Blue Shield insurance, with only 3 out of the 28 receiving their diabetic eye exam. Diabetic eye exam compliance rates at a rural family practice clinic were found to be slightly better when compared to the national 15.3% compliance rate. Based on extensive research, the ADA recommended diabetic eye exams are beneficial in detecting microscopic optic changes in diabetics. However, few providers encourage routine screenings, and many patients are unaware of its importance in discovering irreversible eye damage. 78%, or 39 out of 50 patients from the study, had not received the ADA recommended annual or biennial eye exam. Most insurances will cover a yearly diabetic retinopathy screening. Over half of the patients in the study had Blue Cross Blue Shield insurance, with only 3 receiving a diabetic eye exam. Providers need to be aware of the study findings and its implications. There is significant room for improvement in educating patients on the importance of diabetic eye exam adherence and reporting those findings back to their primary care provider. Patients should be made aware that their insurance will most likely cover the cost, as it is a preventative screening. Providers should be diligent in referring their type 2 diabetic patients for eye screenings to detect microvascular complications before they advance to an irreversible state. These are my references for the poster board and presentation. Thank you.